Welcome to Aetna Better Health of Louisiana. If this is a life-threatening emergency, please hang up and dial 911. All calls are monitored and recorded for quality assurance purposes. If you're a healthcare provider, press star. If you know your party's extension, press 0. Otherwise, please stay on the line for further information.
Para español, marque el 8.
What can I help you with? Say eligibility and benefits, ID card or welcome packet, case management, nurse line, transportation services, mental health crisis support, or more options.
Case management.
Transferring you now.
Your feedback is important to us. After speaking with a representative, please stay on the line to complete a brief survey regarding the service you received today.
If you need a ride or wish to speak to transportation, press 1. If you would like to speak to a member service representative regarding all other questions, please press 2 or remain on the line.
Thank you for calling Aetna Better Health of Louisiana, where your health is our priority. Speaking of your health, have you downloaded the Aetna app yet? The app allows you to find a provider, check if they offer virtual services, see where they are located, and much more, all within the palm of your hand. If you can't download the app, a member services representative can help you locate a provider that meets your needs. You can also go to the Aetna website and use the Find a Provider tool. Aetna wants to remind you to schedule your annual exam, an important first step towards staying healthy.
Thank you for choosing Aetna Better Health of Louisiana. My name is Janet. Now please have your member ID number.
579-403-864-5696.
Okay, so that's 579.
403 864 5696.
Thank you for that information. Let's see here. Okay. And may I please have your first name, first and last name?
Jeffrey Bodin, Jeffrey Bodin.
And Mr. Bodin, may I please have your date of birth?
05/22/97.
Thank you for that information. May I please have a telephone number where you can be reached?
985-272-8989.
Thank you very much. Your home address, including city, state, and zip code.
406 Parkview Boulevard, Manville, Louisiana, 70471.
Thank you very much. Are you still seeing Dr. Callie Linden?
No, I got a new doctor. I haven't seen her yet, but I have her scheduled an appointment with her on the 9th of June. It's Kayleen Tran, nurse practitioner. She's my new primary care provider.
Okay. And please verify, let's see here, verify your email address for me.
JeffreyBodin713@gmail.com.
Thank you very much. How may I assist you today?
I got a letter on Friday. That's detailing it's detailing that my grievance that looked like it was approved, and the individual on the phone spoke to me and said that after I filed a grievance for a medication for the Davimet Chew vitamin that's been prescribed in relation to my stage 4 malignant melanoma and like vitamin deficiency and such for cancer patients and, associated with chemotherapy and things. And I filed a grievance about that because I got a letter at a different address actually that denied it out of nowhere. And the individual on the phone with y'all, the representative, the one out of Kenner, I guess, she seemed like she worked it out to where it was covered, and she called me back and confirmed all of that and stuff. And even in this letter, it says that we found your grievance to be substantiated. This means we agree with your grievance. Then it just says your case has been closed. So I'm kind of confused. Why was my grievance successfully resolved and the medication once again returning back to coverage status, and only for me to receive a letter that was post-dated April 18th, 2025, so like later that week, I guess, sent by a different person, where's that page? Well, whatever. It looks like it was just like there may have been some sort of a mix-up or something, because I don't understand why the multivitamin will no longer be covered by Aetna Better Health Louisiana starting 6/1/2025. Whenever I was just successfully completed a grievance, it got covered last month before the 18th, I guess, of April. When was the 18th? That was Friday. So I spoke to her on, I guess, the 14th of the Monday. I filed the grievance on a 12th of Saturday, I believe. And then on the 14th, everything was resolved completely. I think I even got the medication again last month, possibly, or they ordered it or something. And now it's saying next month on the 1st of June, it's no longer covered. That's a bit odd, I guess. Would it be possible to like redo the grievance again? Because finding my grievance to be substantiated and then still denying it does not seem to be a correct course of action. Especially since it does, from this letter, appear that Aetna sufficiently understood the circumstances. It's not like my cancer wasn't literally written down here. It is stage 4 malignant melanoma. It's like in the first sentence. So it's like, so it's not like there was some miscommunication about the circumstances. It felt like to me on the 14th that everything was ironed out and it was fine. But it doesn't seem to be now. That's I can't afford copays, and they're even saying you would pay your copay if you have one, and so maybe y'all got me mixed up with other patients or something, because I have a $0 copay on my plan with y'all. Like everything gets covered, or it's just not covered at all, but I've never had to like redo a grievance with y'all before. There was only ever issues with dosaging and the state level restrictions on controlled substances, and this isn't a controlled substance, so I don't understand why there should be a why there should be another prior authorization for this. I'm pretty sure there was a prior authorization in for this like a few years ago. So I just wanted to know what I'm supposed to do as my next step for this.
Yes, sir. I'm looking. I see that it looks like you have something pending. It's still open and it's pending, but it does not tell me. Little question. It does not give me any details on this. So what I can do, I can transfer you over to the prior authorization department to see, what details they have, because I see something pending, but it does not show me anything else. Would you mind if I transferred you over?
Yes, ma'am. That's fine.
Thank you very much. You may be offered a brief survey regarding my services at the end of your call. Hold for your transfer, okay?
Okay.
Thank you.
To use for Aetna Medicaid plans. Please log in today to check member eligibility for claim status, authorizations, and much more. For more information or to register, visit availity.com today or call 1-800-282-4548. Good morning. Thank you for calling Aetna Better Health of Louisiana. My name is Keisha. How may I assist you?
Hi. I just was transferred from case management to y'all at prior authorization, or authorizations or whatnot. Case management said that they could see a pending case for a grievance that I submitted on April 14th, or the 12th.
For a grievance?
Yeah, and they couldn't see information on the pending case, so they sent me to y'all to see what you could do about it.
All right. So the thing about it is we don't have they send everything over here. There is no contact for grievances. Basically, you just send it to the Appeals and Grievances Department via email or fax to check the status on it. Is that what you were trying to do?
I'm not sure, ma'am. She just says she couldn't do something on her end, and that this would be the right place to be sent to speak to y'all. Maybe I just didn't articulate it correctly. I received a letter on I guess the last Friday, and it is a grievance resolution. But previously last month on the 14th, I had worked with y'all to cover a medication, and it was covered, and the grievance was resolved in the favor of covering the medicine. And that's what I was told verbally, multiple times that day. They worked it out and stuff, and now I'm receiving from last Friday this grievance resolution that it says at the bottom, we found your grievance to be substantiated. This means we agreed with your grievance. Your case has been closed. So, I'm not...
Oh, let me ask you this.
Really
was this for a medication that was oral or an injectable? Was it sent through medical for review or pharmacy?
This is pharmacy. It's a prescription, Davimet M multivitamin, for... to supplement in my intake for my stage 4 malignant melanoma.
They did send you over to the wrong department. They sent you the prior authorization, but they sent you the prior authorization medical and behavioral health.
Oh, yeah, okay, sorry.
No worries. So let me see something. Give me 1 second. Let me get that phone number for pharmacy prior auth, and I'll give it to you directly as well. Hold on one moment for me. Okay, thank you for holding. Let me give you Pharmacy's number.
So is this prior authorization Pharmacies? Is that what it's called?
Yes. Yes, sir. You ready?
Wait, one sec.
It's
Okay.
866 638 1232. And I believe the options are 3 and then 4.
Okay,
All right,
so...
I'm going to transfer you over directly.
Okay.
Mm-hmm.
All right, thank you.
You're welcome. One moment for me.
Thank you for calling the Louisiana Medicaid Managed Care Organization Pharmacy Call Center administered by Prime Therapeutics State Government Solutions, LLC. We have a new interactive voice response system. Please wait until the prompt has completed to respond and speak clearly so we can better assist you. Thank you for calling. Which are you? For member, say or press 1. For prescriber, say or press 2. To continue in English, say English. Para Español, Giga Español. If this is a medical emergency, which are you calling about? PA, status, new prior auth, claim inquiry, eligibility status, web support or something else? Which are you calling about? PA, status, new prior auth, claim inquiry, eligibility status, web support, or something else? Sorry, I didn't understand that. Which are you calling about? PA status, new prior
PA
auth,
status.
claim inquiry. Say the member ID, or say I don't have it.
579-403-864-5696.
Sorry, I did not understand that. Say the member ID, or say I don't have it. You said 5, 7, 9, 4, 0, 3, 8, 6, 4, 5, 6, 9, 6. Is that correct? Say yes or no.
Yes.
Please say the member's date of birth. For example, you can say February 19th, 1989.
May 22nd,
Sorry, I did not understand
1997.
that. Please say the member's date of birth.
05
For example, you can say
2297.
February 19th, 1989.
May 22nd, 1997.
Sorry, I still did not understand. Please hold while your call is transferred. To ensure quality service, your call may be monitored and recorded. Please stay on the line after talking to the agent for your brief survey. Your feedback is very important to us.
Thank you for calling Louisiana Medicaid MCO Pharmacy Call Center. My name is Daria, Clinical Pharmacy Technician. How may I assist you today?
Hi, I was transferred from Aetna, Better Health of Louisiana, to handle a, I guess, prior authorization inquiry on, I guess, a grievance resolution that was successful, but now I'm receiving notice from Aetna that it's closed and not successful, even though they found my grievance to be substantiated as it states on the sheet. So Aetna's case management couldn't see the full status of it. They just said it was listed as pending, and then they sent me to Pharmacies prior authorization behavioral health on accident, and then the behavioral health prior authorization department sent me here. So I don't know if
I'm
I
sorry.
selected the right
We can't
selections.
see any
but
grievances. I don't think they sent you to the right department. Can I get your name first, please?
Yes, ma'am. Jeffrey Bodin, Jeffrey Bodin.
Eodin?
Bodin, yes, ma'am.
Jeffrey. Okay, and what's your phone number, please?
985-272-8989.
985-272. Can you say that again a little slower?
8989.
Thank you. And what's your member ID?
579-403-864-5696. There is a reference ID for this grievance resolution as well. Just in case.
I need to verify some more information with you first, please.
Okay.
May I have your date of birth?
05-22-97.
Thank you. And is this about a medication or is it about something else?
Medication.
Just a moment. What's the medication?
Davimet M.
So did you receive a letter about this grievance?
Yes, ma'am.
Does it have a phone number on there?
It had the normal member services number. It didn't have a different number. No, it just had the same one that I called and that sent me to you.
Okay, yeah, because the grievances, what exactly was it about? I'm trying to figure out if you've reached the right department or not. I don't think you did.
There's a reference ID for it, but there's no other, like...
I can't look up any reference ID. I don't have access to it.
Oh, okay.
I don't think the grievance was filed through us. I think it was filed through the actual plan itself.
Oh, does the grievance
Just
have
a
to be
moment. Let me
filed
see
through
what plan
you?
you have. It depends on what it's for.
This is for...
That's why I'm saying if you got a letter and it's good.
I mean, the reason for it was a denial of the necessary medication of vitamins to supplement your intake for stage 4 malignant melanoma.
Yeah, that would be a grievance with the health plan because they would have been the one that denied it. Just a moment. So that would go through Aetna's Department of Appeals, Grievance and Fair Hearing. And that number is 1855.
Wait, Aetna
Okay.
Department of
They handle appeals, grievance, and fair hearings.
Appeals. And okay, so what's their number?
1855 242 0802.
Okay,
Let me
that's
just
the
check
number I
one more
called,
thing
but
before
I guess I'll just ask them for that department specifically then.
Yeah, I'm surprised they didn't put a number on your form. Or is that the number on your form?
That is, but it's the number that sends me to my member services number, which is who I called originally. That's the number I called.
Yeah, ask them for the grievances department.
Okay, I'll do that.
Okay, yeah, 'cause, I don't think we handle that specific type of grievance here. Just one moment, I'm looking to see if there's any notes in here about a grievance. When was the grievance filed?
I filed it on the 12th, and they received it on the 14th.
Of April?
Yes, ma'am.
Yeah, I don't even see any notes in our system about it. So, yeah, I would say you have to go through them. Was there anything else I can assist you with today?
I guess just transfer me back to them.
I can't transfer you, unfortunately. You'll have to hang up and call.
Oh, okay. Thank you.
You're welcome. Thank you for calling. Please hold for a brief survey. Thank you.
Your response on the service you just received is very important to us. How likely are you to recommend us to a friend or colleague? Please say a number between 0 and 10, with 0 not at all likely and 10 extremely likely. Has your reason for calling today been resolved? Please answer by saying yes or no.
No.
How easy was it to resolve your issue today? Please say a number between 0 to 10, with 0 for very difficult and 10 for very easy. Based on your interaction, how satisfied were you with our agent who assisted you? Please say a number between 0 to 10, with 0 being not at all satisfied and 10 being very satisfied. Overall, how would you rate your prescription drug plan? Please say a number between 0 and 10, with 0 being poor and 10 being excellent. Thank you. Your response will help us ensure we meet your service expectations. Goodbye.
Welcome to Aetna Better Health of Louisiana. If this is a life-threatening emergency, please hang up and dial 911. All calls are monitored and recorded for quality assurance purposes. If you're a healthcare provider, press star. If you know your party's extension, press 0. Otherwise, please stay on the line for further information.
Para español, marque el 8.
What can I help you with? Say eligibility and benefits, ID card or welcome packet,
Appeals and
case
grievances.
management. I missed that. What can I help you with? Say eligibility and benefits, ID card or welcome packet,
Grievance.
case. Let's try this. For eligibility and benefits, press 1. ID card or welcome packet, press 2. Case management, press 3. Nurse line, press 4. Transportation service, press 5. Mental health crisis support, press 6. Or more options, press 7.
Seven.
Transferring you now.
Your feedback is important to us. After speaking with a representative, please stay on the line to complete a brief survey regarding the service you received today.
If you need a ride or wish to speak to transportation, press 1. If you would like to speak to a member service representative regarding all other questions, please press 2 or remain on the line.
Thank you for calling Aetna Better Health of Louisiana, where your health is our priority. Speaking of your health, have you downloaded the Aetna app yet? The app allows you to find a provider, check if they offer virtual services, see where they are located, and much more. all within the palm of your hand. If you can't download the app, a member services representative can help you locate a provider that meets your needs. You can also go to the Aetna website and use the Find a Provider tool. Aetna wants to remind you to schedule your annual exam, an important first step towards staying healthy.
Thank you for choosing Aetna Better Health of Louisiana. My name is Janice. Now, please have your member ID number.
579-403-864-5696.
Okay. Can you please provide me with that number again for me?
579-403-864-5696.
Thank you for that information. And now please have your first and last name.
Jeffrey Bodin, Jeffrey Bodin.
Okay. And now let's see here. Oh, one moment.
Under control, we are unavailable to handle your call. We appreciate your patience and ask that you contact us at a later time.